and we would all like to see it go through. Mr. Davies, 7 minutes.
Thank you, Mr. Chair. Thank you, Minister, for being here and for your graciousness in foregoing your statements. We could have a chance to ask you questions. Minister, of course, there are many complex causes of the opioid crisis, but one significant aspect has been largely untouched by the federal government thus far, and that's the role that opioid manufacturers may have played in marketing these products in Canada. There is growing suspicion that drug manufacturers promoted a proliferation of prescription opioid use in Canada over the last 2 decades through an effort to minimize or conceal the risks of their products. That conclusion has been proved in American courts. In fact, the U.S. Federal Justice Department has secured criminal convictions, and they have recovered, along with states, almost $1 billion in fines and other costs as a result of violations of the Food and Drug Act. Last summer, the NDP government in BC filed a civil lawsuit against drug companies to recoup the enormous costs incurred by that province in addressing the crisis. And this week, of course, the government of Ontario joined that proposed class action. So, Minister, simple question, is your government planning to join that class action against opioid manufacturers?
Thank you, Mr. Davies. Thank you so much for the question. And I have to say, we're following very closely the 2 lawsuits that have been filed by British Columbia and also this week in Ontario. Our legal officials are reviewing those 2 matters, and a decision will be made to see what exactly the federal government is going to be doing.
Thank you. So, Minister, I went back and read the mandate letter that Prime Minister Trudeau gave to your predecessor, Minister Philpott, back in 2015, and that mandate letter instructed her and you, when you got yours, to make prescription drugs more affordable for Canadians. But according to the Canadian Institute for Health Information, prescription drug costs have grown for Canadians every year of your government's mandate through the end of 2018, anyway. Why has your government been unsuccessful so far in fulfilling that mandate and actually lowering the real cost of prescription drugs for Canadians?
Well, I think we all recognize that the price of drugs is a complex matter, and we are working hard to make sure that we do all that we can to lower the price of drugs. If we want to move forward with the National Pharmacare program, we have to get this right, and we have to lower drug prices. That's why that we're still in the process of modernizing the Patented Medicine Prices Review Board. That work is well underway, and we'll have some announcements to be made. The other thing as well, when we indicate that we weren't able to lower the price of drugs, I don't completely agree with that, because by joining the Pan-Canadian Pharmaceutical Alliance, we have actually saved over $2 billion per year with respect to lowering the price of drugs. And as we move forward with respect to a national pharmacare program, the Canadian Drug Agency as well will have a significant role to play. At this point in time, the HESA members more than I know all of the intricacies of pharmacare, because you've certainly done a study. But when you realize that we have over 100,000 private drug plans in this country and many more through government, it's very hard to negotiate drug prices. So if we can put this together, get this right, and get a national pharmacare program, I think there's going to be a cost saving for everyone here.
Absolutely. Yeah, and one of the reasons the NDP supports public pharmacare is to replace those with one MSP plan per province would be enormously efficient. You anticipated my next question on the Patented Medicine Prices Review Board. It's puzzling to me, Minister, because almost 3 years ago, your government promised to overhaul the Patented Medicine Prices Review Board to lower our drug prices. The Finance Department estimated that those reforms would lower drug prices for Canadians by $12.6 billion over 10 years. And then your government announced that those changes would be put in place at the end of 2018. Yet they have not to this day. We're in 2019, almost June. We still don't have them. Why has your government been so slow to implement changes to the PMPRB that everybody knows would immediately start saving billions of dollars in lower costs for Canadians? Sorry. Yeah, I'm just curious why you haven't implemented when they're so obviously there.
Well, once again, this is work that is well underway. And as I've indicated earlier, there's going to be some announcements that are going to be made with respect to the modernization of the PMPRB. Since I've been Minister of Health, this is a file that we're actively engaged in. When it comes to, again, the implementation of a national pharmacare program, it's more than just putting a program in place. The priority is lowering the price of drugs, and we certainly want to get this right.
This isn't pharmacare. These are changes to the PMPRB that you could do right now, whether it's pharmacare or not. I mean, something like taking the 5 comparator countries that we use, including the U.S. and Switzerland, the 2 highest prices in the world. Everybody in Canada that looks at this subject knows that you have to get rid of those 5 and put a comparison of 12 countries that are more representative, Germany, France, etc. You could do that tomorrow. Why wouldn't you do that and immediately start lowering costs of pharmaceuticals today?
Once again, I've indicated there's going to be an announcement in the very, very near future.
Thanks.
So stay tuned.
Another thing that's puzzling to me is that your government just signed a new NAFTA, if I can call it that. I wrote a question to the Parliamentary Budget Officer and asked how much the extended protection for biologic data protection that the Canadian government conceded to the U.S. would cost, and his estimate is $169 million per year. So if you want to lower the price of drug costs for Canadians, why would your government sign a trade deal with the U.S. that's going to cost Canadians billions of dollars in extra costs over the next decades? Why would you do that?
Well, I can't respond with respect to the negotiations that take place, but what I can tell you as Canada's health minister, my priority has really been to do all that I can to lower the price of drugs. And that's why that we've been actively engaged with respect to joining the Pan-Canadian Pharmaceutical Alliance, where we have been able to lower and save money. The other thing, as well as I've indicated, we are in the process of modernizing the Patented Medicine Prices Review Board, and all of that is saving us a substantive amount of money. Perhaps if my deputy minister wants to comment any further, I'll punt it to him.
Well, if I can just get one more question in. Sure. Minister, pharmacare advocates were recently quite alarmed to see you deliver the keynote speech at a Canada 2020 forum on May 14th that was dominated by lobby groups that oppose universal public drug coverage. Doctors who support that coverage called it a one-sided event. Former Liberal Health Minister Jane Philpott reacted to your speech saying that the one-sided event is problematic and makes her nervous about the government's commitment to pharmacare. It was sponsored by the Insurance Association and Innovative Medicines of Canada, which represents Canada's pharmaceutical industry. Minister, do you agree with those that your participation in that event was problematic? And how do you respond to pharmacare advocates who argue that corporate lobbyists appear to have too much influence on your government's pharmacare deliberations?
First and foremost, I would disagree that the lobbyists have influence over us. I have to say that I'm invited to speak to a number of events over the course of a year as Canada's health minister, and I'm very proud to do so. When it comes to the National Pharmacare Program, if you were to see my notes, and I can provide them to the committee here with respect to my message that I gave to them, it's always the same message. It's always a very consistent message that our plan moving forward is to move forward with the National Pharmacare Program.
Is that a public plan?
Pardon me?
Is that a public
Well,
plan?
I think we'll have to wait to see what the recommendations of the committee and to see what the decision is as we move forward.
Okay, time is up.